Smoking or vaping, the lesser evil. Smoking has long been a pressing public health issue, with global medical experts cautioning against its severe health effects and its threat to public well-being. In recent times, vaping has surged in popularity as an alternative to smoking. Although perceived as less harmful, it remains highly addictive, and its long-term consequences remain unclear due to its novelty. Recent studies have associated vaping with an increased risk of lung and cardiovascular diseases. Concern is mounting about vaping's impact on children. Data suggests that vaping is more prevalent among children than smoking ever was. Between 2022 and 2023, there was a 50% increase in the number of children experimenting with vaping. We're halfway expecting a vaping emoji to show up on our keyboards soon. Smoking and health. As per the World Health Organization, tobacco claims the lives of 8 million people annually, including 1.3 million non-smokers who succumb to secondhand smoke exposure. Among smokers who persist, 1 in 3 will ultimately perish due to their habit. Smoking stands as the primary preventable cause of death worldwide and remains the leading trigger for cancer. Approximately 90% of male lung cancer cases and 70 to 80% of cases in women are directly linked to cigarette smoking. With tobacco wreaking havoc like the ultimate villain in a blockbuster, it's like smoking found the perfect role as the Grim Reaper of preventable deaths. It's no joke, though. The Centers for Disease Control and Prevention, CDC, emphasize that smoking not only leads to cancer but also elevates the risk of heart disease, stroke, diabetes, lung ailments, and chronic obstructive pulmonary disease, COPD. Additionally, it is associated with higher chances of eye diseases, tuberculosis, and immune system disorders. Emergence of vaping. The utilization of e-cigarettes, or vaping, differs from the conventional smoking of tobacco. It operates through a device that heats nicotine, flavorings, and other chemicals to generate an aerosol inhaled by the user. Vaping is commonly perceived as a less hazardous option compared to smoking. Despite not exposing users to tobacco smoke's detrimental elements like tar or carbon monoxide, vaping isn't devoid of risks and poses its own health concerns. With 2.55 million US middle and high school students picking up e-cigarettes in 2022, it's like vaping became the coolest, in-crowd trend. It's almost as if blowing vapor clouds became the new secret handshake at school. Who knew that blowing bubbles would get dethroned by blowing vapor puffs? While many experts acknowledge vaping as less harmful than smoking, it's not a risk-free alternative and shouldn't be endorsed as such. Respiratory health and vaping. In 2019, news surfaced regarding severe and abrupt lung issues associated with vaping. Dubbed e-cigarette or vaping use-associated lung injury, EVALI, this condition led to the hospitalization of 2,800 patients, with 68 reported deaths by February 2020. Tragically, most cases affected teenagers and young adults. Since the EVALI outbreak, researchers have delved into understanding the disease's mechanisms. Presently, it's understood that the disease's pathophysiological mechanisms likely involve cytotoxicity and neutrophilic inflammation resulting from inhaling the chemicals present in vapes. E-cigarette use has also been connected to pre-symptomatic cardiovascular problems. The vapor from e-cigarettes carries harmful substances such as diacetyl, associated with lung disease, acrolein, causing lung injury and COPD, and aldehydes, known for lung and heart diseases. Additionally, e-cigarette vapor comprises cancer-causing chemicals, heavy metals, and volatile organic compounds, VOCs, posing significant health risks. Furthermore, e-cigarettes present a secondhand smoke hazard, akin to regular tobacco cigarettes. Contrary to some arguments, these devices don't emit harmless water vapor. Instead, their vapor contains a mix of toxins known to cause cancer, nicotine, and ultrafine particles. Vaping versus smoking. Vaping remains a relatively recent phenomenon, lacking extensive data on its long-term health repercussions. In contrast, the health hazards of smoking are extensively documented. Consequently, a comprehensive comparison between vaping and smoking is currently unfeasible. What is evident is that vaping doesn't present a risk-free substitute for smoking and has been linked to heightened risks of various diseases, including lung ailments, stroke, cancer, pneumonia, and potentially mental health conditions like depression and anxiety. Who knew puffing on what seemed like harmless flavor clouds could lead to a storyline worthy of a Netflix series? Impacts on public health. Addressing the escalating popularity of vaping among youths and children is an urgent necessity. E-cigarette companies face accusations of purposefully directing their marketing toward young adults and adolescents through methods like social media engagement, sponsoring festivals and music events, and offering appealing flavors designed for youth. Without proactive measures safeguarding young people from vaping, the upcoming generation might encounter a range of unclear yet potentially severe health consequences. What remains evident is that vaping poses health risks, and it's crucial to shield children from adopting this habit. It's equally vital not to view vaping as a healthy alternative to smoking. Opting for healthier alternatives. Although experts tend to acknowledge that vaping's health risks are generally less severe compared to smoking, health organizations should continue to discourage vaping, prioritizing the protection of children from its introduction. While some advocate using vaping to aid smokers in quitting tobacco, users should be fully informed about the associated risks. Numerous strategies employed to combat smoking could be adapted for vaping, including adding suitable warnings to vaping products and withdrawing them from prominent displays in stores. It's like vaping tried to be the cool cousin at the health party, but sorry, even with its fancy flavors, it's still not getting an invite. It's all fun and clouds until someone starts reading the fine print on the risks. It's like the health world's version of, oops, we did it again. But this time with vapor. Enjoying our content? Don't miss out on future videos. Subscribe now and hit the notification bell to stay updated with the latest uploads.